Welcome, everyone. Thanks for joining us today. Hope you can hear me well. My name is Omar Dawahere. I'm director at Partners for Advancing Health Equity. We're a research learning collaborative based in New Orleans at Tulane's Celia Scott Weatherhead School of Public Health and Tropical Medicine, and we're funded by the Robert Wood Johnson Foundation. Welcome to the third and final session, sadly, of our workshop series on narrative power, which we've been holding in collaboration with Partnership for Southern Equity over the last 3 weeks. It's been a wonderful experience to be partnering with them for this series. And thus far, we've learned about PSE's use of narrative power to promote racial equity. They've trained us on just health narrative. And today we'll hear from their Circle Initiative partners and their experiences. Earlier yesterday, we shared with all who registered for the series a few resources and information about our guest speakers who you're going to get to know in a little bit. We'll share those links through the chat shortly. Please feel free to share your thoughts and interact through the chat throughout the series, throughout the session. We'll also have some time in the end for questions and answer. And note that this session is being recorded for learning purposes, but nonetheless, your identities will remain anonymous. Before moving on, I'd like to also share a cordial invitation to you for a quarterly webinar on this very same topic on June 24th at 1 p.m. Central Time. And it's titled The Stories We Tell, Shifting Power Through Storytelling and Health Equity. So hope that you can join us. I'll also be sharing link to the registration page for the webinar. So without further ado, I'm going to pass it along to Opal Gay from Partnership for Southern Equity to introduce the session and our guest speakers. Thank you so much for sharing your time with us today.
Thank you so much, Omar. We can get the slides up. But welcome, everyone. If this is your first time seeing me, hi, my name is Opal Gay. I'm a senior research analyst at the Partnership for Southern Equity. And if you're unfamiliar with PSC, we are an Atlanta-based organization committed to advancing racial equity and shared prosperity across the U.S. South. And I love to begin these conversations with, dropping in the chat where you're from. And if you're from the South, give us, a shout out because we hold it down here in the South. And, you know, part of this session is about the pride. And the resilience is so overused. But the power historically that we have built down here in our region and how we leverage narratives to build institutions that keep all of us well. So if you're from the South or not, please give a shout out in the chat where you're joining this conversation from. We have an exciting session scheduled for you today. As Omar already mentioned, we'll be having a group of practitioners that we'll be speaking with and gaining insights about how they are wielding narrative power as a tool to advance racial equity in their everyday practice. So we're super excited and happy that you could join this conversation. And again, if this is your third workshop with us, welcome back. Um, Next slide, please. All right. I'm not going to spend too much time here because Omar already addressed it in pretty good detail, but note that we're going to have some time at the end. If folks have questions, you will be muted at the front end of this conversation, but we will open it up for verbal engagement near the end for folks who have questions. Next slide. This is Team PSC. You will largely be hearing from me today, but I did want to take a moment to acknowledge the other PSC team members who have been a part of this session. Nathaniel, unfortunately, will not be able to join us today, but want to just note that his vision and leadership are very much present and the inspiration for the Circle Initiative. If Kirsten and then Robin want to come off and briefly introduce themselves.
Hi, everyone. I am the Director of Research and Analytics at Partnership for Southern Equity and happy to be here for our third session.
And Robin, if you cannot come off, that is totally fine. Okay, perfect. Thank you, Kirsten, and again, thank you all. If you have questions more about what PSC does, feel free to find our contact information available on the Partners for Advancing Health Equity website. Next slide, please. All right, so again, we are in our third session. Omar did a fabulous recap of the first two sessions. So I will just jump right into our conversation that we're going to be hosting today, which is essentially we wanted to move from a conversation about the sort of theory of narrative power into what it looks like in practice. And for us, what that meant was bringing in voices from across sectors within our circle network who are not just thinking about narrative power, but applying it strategically. The panelists joining us today work at the intersection of multiple fields, including medicine, public health, marketing, community organizing, and the arts. And their collective expertise speaks to the breadth and scope of how narrative can be leveraged in the field of racial equity. But before we get into the questions that we have prepared today, I just want to take a brief moment to introduce our remarkable practitioners. So we can go to the next slide. We will start with Dr. Stella Sappho, and Dr. Sappho will be leaving us a bit early today for a prior engagement. So just want to note that on the front end. But Dr. Stella Sappho is a board certified HIV primary care physician, a public health advocate, and the founder of Just Equity for Health, a healthcare improvement company that uses advocacy, education, and care model design to ensure equitable care delivery across all sectors of medicine. Dr. Saffel has experience in clinical transformation and healthcare redesign and academic and corporate healthcare settings. In addition to her commitment to population health and care model design, Dr. Sappho is dedicated to equity within healthcare. She is a founding member of several organizations dedicated to gender and racial equity and to civic engagement in medicine. She co created the Green Book for Health with the ARIA Foundation to empower and guide Black people in their healthcare journeys. Our next panelist, who will be joining us actually as Dr. Sappho will be leaving, is Layla Cole, who is a strategist, creative storyteller, and founder of LC's NYC, a creative marketing agency dedicated to driving impact for mission driven clients. Layla's fashion industry expertise across marketing, public relations, publishing, and strategy has purposefully taken shape into a professional transition to law and public health. Layla is an incoming MPH JD candidate committed to advancing health equity and upward mobility for all. She leverages her skills as a creative storyteller to lead communication and strategy for the Green Book for Health. And Layla is particularly invested in the Green Book for Health and strongly believes in this work. And then our third panelist is Matthew McCurdy, who is a doctor of public health student at the Harvard T.H. Chan School of Public Health. He is a public health leader dedicated to advancing racial justice, community power, and design driven innovation in health. As co founder and executive director of Black Health, he leads work that confronts racism as a root cause of health inequities and reimagines how health education, advocacy, and care can be designed within Black communities. Before founding Black Health, Matthew earned his MPH from Emory University, Rollins School of Public Health, and held roles at the Center for Disease Control and Prevention and the U.S. Department of Health and Human Services, where he served as a President Management Fellow and Strategic Advisor. And then last but certainly not least is Maya Robinson, who serves as the president of the Out of Hand Board of Directors and as director of annual programs at the Grady Health Foundation. Out of Hand works at the intersection of art, social justice, civic engagement, and engagement. She is a seasoned professional with over 20 years of experience in nonprofit management. While theater is her first love, she has enjoyed a rich fundraising career with the performing arts, human services, and now healthcare. She believes that her superpowers are helping people match their personal philanthropic goals with worthy nonprofit organizations and opening hard to open jars. Let's give a nice virtual welcome to our panelists. Get those virtual hands clapping. And thank you all so much for taking the time to be here and give a little bit of expertise. So let's go ahead and jump right into it. I'd like to begin by grounding us in practice. So the first question is, can you share an example from your work of using narrative power as a tool for change? And if you would, Dejan, could you drop the slide deck? And if we could begin with Dr. Sappho.
Sure, I'm happy to share. I have the pleasure of taking care of people living with HIV. And I think the first time that I really understood the power of the narrative kind of input in driving change was when I started working in policy work with my organization Just Equity for Health, specifically looking at how we could drive gender and racial equity within New York City. And we were able to successfully pass a law that created an advisory group to really look at how hospitals are treating individuals. And part of why we were successful is because we told the stories. We told the stories of ourselves as healthcare workers, Black and Brown healthcare workers who had experienced discrimination at the hands of these institutions. But I think even more importantly, we told the stories of the individuals that we have the pleasure of caring for our patients. And I remembered, testifying in one of our town halls around the experience of a woman who went to the emergency room for knee pain, but she had HIV. And she said, once she told the doctor about her HIV. He stopped asking her any questions about her knee pain and only wanted to focus on the HIV. And she left there with no solution for her knee pain. And she said, I will never go back to the emergency room unless I'm like dying. And you just think about the impact of that and what it means when individuals are not treated well or not seen, and how that has an impact, not just on the individual, that woman herself, my patient, but also she's a mom of three. How will she take care of her babies in a system that feels like it doesn't see her and is discriminatory? So I shared that story and we shared stories like it. And it had real power. And I think sometimes when we are on the front lines, either as public health folks, as community organizers, as activists, as clinicians, we know these stories so well. We live them. We're with people all the time. And we forget that many other spaces, especially the civic engagement world, the policy world, a lot of our lawmakers are very removed from reality. They don't know what's happening on the ground. I don't say that in a disparaging or a mean way, but I've met with lawmakers who have said, thank you. We never knew that this was what it was in the clinics, in the hospitals with patients. And so I just think there's so much power there. And that's one of the experiences that really brought that clearly into my view and has made me want to take the time to share. And I'll also just say, as someone trained in the scientific background, we're taught to really think about population data, population level data and statistics and, really large epidemiological data sets. And we don't tend to rely as much on anecdotes. And yet, again, the spaces where I've found that I've had the most impact and power to move and drive change is when we're talking about the individual versus talking about these big numbers. And so that stays with me. And I think that that's why this series has been so important because the power of the narrative really is supreme.
Thank you so much. If you have any insights, Matthew, I'll invite you off the chat.
Yeah, thanks, Opal. Yeah, when I think about sort of the narratives and narrative power that we're trying to bring or change at Black Health, really it's moving from an individual deficit-based lens of health for Black communities and more to a systems and sort of aggregate level look at how health and how we intervene on health. And I think Omar dropped in the Believe My Pain campaign that we ran with Advil, where we had an opportunity to hear from people who've had improper experiences with their pain care. So often for Black people, when we interact with the healthcare system, we're not believed. We're treated as non-compliant. We're thought there's a myth that we're like biologically different in ways that really justify different health interventions. And the real goal of that sort of narrative campaign was one to share stories about people's experiences with the healthcare system, but then to move healthcare to one, believe the pain and believe the expertise that Black people have over their own bodies, but also to see that engagement as a part of a larger structure, right? And the structure that delegitimizes the experiences that Black people have that cause them to not interact with healthcare systems, and really to have healthcare take a inward look and say, what are the changes that we need to make as an institution, as a system, to really help and support Black people, one, to be believed, but then secondly, to get the care that they need. And so by creating something that was publicly visible, there's ads sort of ran all throughout Metro Atlanta. You can see them at bus stops, and then of course the digital stuff as well. Really allows for a conversation change and sort of shifting the narrative on how we think about Black health. And so, one of the many examples of how we're using narrative, and hoping to dive into some more throughout this discussion.
Thanks so much, Matthew. How about you, Maya?
Thank you. And thank you for having me today. I really think about our out of hand theater. Our signature program is called Shows and Homes. And last spring, we featured a play called How to Make a Home. And it was about homelessness in Atlanta. And we were able to tell the story of this gentleman who was experiencing homelessness and the story of his family, and it really humanized the issue, and it also went up against a lot of misconceptions and assumptions that people make about people who are experiencing homelessness. And we often heard after performances that, wow, I never thought about any of this before. I never thought about how the various circumstances can impact someone who finds themselves without permanent housing. Because we find that at Out of Hand, now narrative power works because people don't change their minds during arguments. A lot of times you dig your heels in and you're right and you believe that you're right and you're not even listening. But when we tell a story, a well-researched story that puts that turns that on its head, and it's not about stakes. You don't have any personal stakes in a third person story. People really do change their mind, and they open their mind to things that they didn't realize about a particular topic. And so that's really the power of Out of Hand, is to have facilitated conversations after those performances and having well-researched performances.
Thank you all so much. What's coming through for me as I'm hearing all of you speak is sort of a through line of the work that you do is working alongside communities who are navigating histories of delegitimization, extraction, negligence at the institutional level, and really at the cultural level as well. Which brings me to the next question, which is when you're going about working with these populations, with these individuals, how does trust fit into that conversation? When we're looking to build narrative power, how do you nurture both trust and care throughout these engagement processes? And we can begin with Matthew.
Yeah, no, I think it's a great question. And I think it really starts with like a deep question about who are you actually in community with, right? Who are actually your people? Um, and I think often we imagine that we are in community with people who we actually never interacted with. And so the work that we are doing at Black Health is, showing up consistently, ensuring that the people that we have identified as our people know us, trust us, and then to treat the work as participatory and relational and not transactional. I think often, there's an advocacy campaign or some narrative project that people want to do, and it's like, I need your story. I need to hear from you. Um, and then people disappear, right? And so I think what we've really tried to practice is, how can we both serve as a benefit and a resource and a tool and a mechanism for change for communities, so that when the ask does come, it doesn't seem foreign and it seems a natural part of the relationship that we've built. And then once we have that relationship, is protecting the vulnerability, the care, and all the emotions that come with sharing, both a happy or a sad story. And it's really important that we use the narratives in ways that honor the participants that have shared them, and that we don't and that we're, really attuned to what the needs are for the community. There are ways that people can use narratives that actually don't uplift or change things for communities, and we want to be creative about how we are solving community issues through narrative. And so, yeah, I think just realizing who your people are, building that trust, and then continuing to support those relationships.
Thanks, Matthew. I'll invite Maya.
Yeah, I would probably will echo a lot of what Matthew is saying. When we create our pieces, especially with Out of Hand, we start with the community, and we actually start with our community partners. We're constantly listening to what do people need to hear stories about, and then we work with our community partners to listen and to have safe, supportive ways for people to share their stories before we create the art. So that we're not just sort of creating a play and then finding an audience for it. We are actually listening to our audience. Who, what audience do you want to be in? What story do you want to hear? And then we're creating those stories from that audience, and we're creating spaces where people feel respected, they feel heard, they feel valued. We have trained facilitators at every level, making sure that we're collecting those stories and honoring them, and then we bring that story back to them. And they know that we're not going to disappear. We're not going to take their stories and go tell them in foreign spaces. We're actually going to tell the story to them. And we have a process where we give people an opportunity to give us feedback before the play is finalized, so that it isn't just let's put on a show. It's actually, how do we create a piece of art that leads to a conversation that leads to change? And we have to begin with that end in mind whenever we start a new production or play.
Thank you so much. And I'll just say for everyone that's here, I had the opportunity to see one of these plays in person, and they are truly transformational and definitely get the conversations flowing in ways that bring in nuanced, diverse perspectives. And so it's a really creative and innovative approach. So I'll invite Dr. Sappho to close this question out.
Sure. I just want to say I love what Maya's described with the process and the ways that the stories are like an artistic reflection of what folks are asking for. I think that's just really powerful. A couple of thoughts come to mind, and I think to really be able to contextualize it, I want to describe the work that we're doing with the Green Book for Health. And so during the insanity of COVID, I would do a lot of talks with community members, Black community members, about the importance of, seeing your doctor, getting vaccinated, doing all the things that we were trying to do to keep our communities protected because we were suffering and dying from COVID at much higher rates than other folks. And so one of the things that folks would say to me is they're like, Doc, you're always coming here to tell us to go see a doctor and do our screenings and whatever, but like, where should we go? Where is it safe to go to get healthcare? What facilities are safe? What healthcare workers are safe to go to? And folks said, we want something like a green book, like the original Green Book. We want something like that for health. And that's how the Green Book for Health was born. It is both a physical book where that offers information about how to navigate your healthcare journey wherever you end up as best as you can. And then there's an app that we've created that lets you find clinicians or health centers close to you that other Black folks have said are affirming, are good, are safe. And the power of narrative for this project is throughout the whole thing, because it's the story of the original Green Book, the Negro motorist Green Book from the 1930s, that kind of led to this sense of let's pull this together for ourselves for now. First, it's just sad that we are pulling back items that we used in, the Jim Crow South. We're pulling them back now in 2026, but it's also not surprising because we know the history of this country and the way that things have in many ways stayed the same. But it was the narrative of the kind of historical narrative that fed into our feeling of we can create this. We can create something that serves our community, that's inspired by community members, filled in by community members, and helps our community members. The other portion of it that I've found really powerful, looking at everything that's happening in our world right now with the rise of white supremacy, with the way the media is moving, one of the things that I felt is that our stories as Black folks are being erased or not being told the way we want them to be told. And as part of the Green Book work, we've actually started to collect stories about individuals' healthcare journeys. And the way, to Matthew's point about, it not being extractive and you use it for advocacy and they never hear from you, the way that we've approached this is to actually keep it as an internal library. So this is for us. It's for our community. We're just collecting these stories for us so that 20 years down the line, if my daughter's generation wants to look back and see what the Green Book for Health Project did and how we, brought in insights from community members, they can see that in this archive. Will we use some of it here and there, obviously with approval? Sure, but that's not the aim. The stories are for us. And I will say, it's one of the first times that I've done something like this where we gather stories that are truly just for us. But it feels important because how we end up gathering our history is part of, I think, the power of how we solve for some of the problems that we face. And so I just wanted to share those examples of what we're doing in real time with, not investing in things like trauma porn, which we see way too often happen around collecting Black stories, but really doing so in a way that is reflective of our need to protect our own history and to understand how we're coming through the time that we're coming through. And also the power of the historical narrative to create and kind of inspire us to build, because that's what got us here with from the original Green Book to this Green Book for Health. And that's what I'll say.
Thank you. And I know that you have to leave soon, so I'm gonna, if I can, start with you for the next question. So what aspects of narrative change and storytelling do you believe remain inaccessible to some people? And how do we work towards making this more accessible?
Yeah, I think about this a lot, actually. So one of the things, my mom is from Ghana, and she has an incredible story of surviving famine in Ghana, going to Nigeria, coming here as a doctor, but having to start again as a home health aide and getting her medical degree again, and so on and so forth. And I've thought a lot about, how do I capture this woman's story? Because here she has these 4 kids that have gone on to be successful. She's helped her village back in Ghana survive so much. I think one of the barriers to this, to the way that narrative change actually becomes narrative action, or action inspired from narrative, is the gathering of these stories. Because I think a lot of times many of us feel like, oh, this is just my mom, her story's cool. And we don't think of necessarily about the kind of official recording of it. So I've actually been working with her to just get audios of what she's been through and to think about how we write something. Again, not always thinking about who the consumer is externally, but maybe the consumer is just her great grandkids, her grandkids, right? And how powerful these narratives are. Again, when we think about what our people have come through and continue to go through. And so for me, I think a lot about how do we capture that, and how does every person capture that? One of the amazing ways that we do is these, machines in our phones. I mean, in our hands, that have so many capabilities, from recording to transcribing to all of the things. And it's not to say that each and every one of us suddenly is a producer and is a director, but there's power, I think, in the everyday stories. And I think the first step is to feel empowered to capture those important stories and to keep them, and then to think about where they end up going. That's something that I think the folks in this room can really help us consider even more now. And I'm here, I'm going to remain for a couple more minutes, and my colleague Leela is joining as well. And I'll pass on this question 3 to Matthew or Maya.
Yeah, I'm happy to jump in. I think to Dr. Saffo's point, like I think our cell phones have really created the opportunity where anybody can be a storyteller, and I think what's super important is to really fight against that dominant narrative that it takes some sort of professionalization to be a storyteller, right? Like you need to be an academic or a filmmaker or some sort of professional communicator. We often teach people at some of our workshops on how to tell their own stories. And I think the sort of accessible frame that we've used is, one, what happened to you, what happened to me as an individual. Two, what's happening around me. So what's happening in my community, what's happening to the people I love, the people I work with. And then I think three, to get again to Dr. Safa's point about what comes next. What should happen next? What is the imagination or the activity or the movement that should happen, given the responses to the first two questions? And we found that this structure really helps people sort of simplify the stories, but also see themselves as a part of a larger context and community, which I think is really important as well. the things that happen, whether good or bad, are not isolated incidents or personal failures or personal successes. They are part of systems, again, that replicate processes and outcomes for people. And so we find that really using that sort of 3-question prompt really helps people to see like, hey, this actually is something that is happening larger than me. And this is what I want to do with it. And I think that third question about what happens next is super important, to move people from this is the thing that's happening to this is the thing that I think should happen, and creating that imagination. I think I know we're going to talk about futurism in a bit, but I think to quote one of my favorite Southerners, Andre 3000, he has this quote in the art of storytelling, which is, I tell it how it is and I tell it how it could be, which I think really encapsulates what we want to do with storytelling. So yeah, that's what I think.
I love appreciative inquiry, and asking questions and telling stories. For us, with Out of Hand, we know that as a theater, we're up against what people traditionally think of as theater. And frankly, that is not what we do. We don't have a set space. We don't perform in a theater, in a traditional theater space. We bring our plays to the community. We performed in homes, we performed at MARTA stops, at churches, community places, wherever we can gather. That's where we perform, and that is a big part of our mission, is to take theater out of the theater and actually make it more accessible, so that people are not dealing with cost of a ticket or the cost of transportation, getting there. You don't have to dress up, come as you are, stay there, stay that way. Actually, our entire financial model, ticket prices is a very small portion of our overall budget. And that is done on purpose so that we can bring our plays to people. Because again, the goal is the art to create the conversation, to create change. Our goal is not to sell tickets. So that's a big part of what we do to make it more accessible. Phones definitely make storytelling easier, but also giving people space to know that their story is important and their story needs to be told. By telling well researched stories, and actually partnering with the community to say, we want to tell your story. It gives people that license to say, hey, I should be telling my story. My story is important. I think, like a lot of kids, I would ask my great grandparents questions, while they were still here. And old people didn't like to talk about it. Like, oh, that's not important. Nobody wants to know about that. But actually, we do, because that's where we make change. And your story is important because you're important. And we can't make that change without everyone. Without everyone. Um, so again, taking theater out of traditional spaces and into the community, and making it really accessible. Um, come to your neighbor's house to see Out of Hand. You don't have to go downtown. You don't have to go to Midtown. You don't have to dress up.
Thank you all, and welcome, Layla. It's so lovely to have you on the panel. We're going to transition into our next question, which really builds on so much of what you've already mentioned, which is about the accessibility of sort of individual narratives at scale. Um, there's a risk in focusing too narrowly on individual stories without connecting them to the broader systems that shape them. Individual stories are powerful, but without context, they can inadvertently place the burden of systemic issues on the individuals who experience them. Someone's health outcomes, for example, can look like personal choices when examined in isolation, but it tells a very different story when placed within the systems that constrain these choices. From your perspective, how do we ensure that individual narratives are connected to the larger structural and systemic forces at play? And who is responsible for making these connections visible? And I'll start with Matthew.
Yeah, I think it's a really important question, and something that certainly touched on in previous responses. Yeah, I think to start with the, I guess, last question, I really see it as the role of sort of researchers, advocates, and storytellers on sort of a macro level, who are organizing, collecting stories to make that connection. I think, Opal, to your point, as we if we don't make that connection, we really risk individualizing things that are systemic, and really hiding the systemic things that are happening, right? So when we're thinking about housing inequities or environmental racism or gaps in healthcare access, if we only talk about individual behaviors, we're really limiting the perspective on the action that should take place as a result of the stories that we're telling, right? And so what we're really looking to do with narrative power and sort of systems change in general is to say, like, this is an individual experience. Again, this is connected to a larger systemic issue. And then these are the systems that need to shift and change so that we aren't seeing these individual stories happen on occasion, for those that are sort of negative. Um, and so at Black Health, we think that's one of our key and primary responsibilities as a community-based organization, advocacy organization, media organization, to really transform, not only for our community, to say that this isn't, that you shouldn't feel guilt, shame, or blame because of this, but this is actually you're existing within a system, and it's the system that needs to change in order to not replicate these outcomes. And so I think it's important that we continue to do that for not only our audiences, but for the audiences and the systems that then need to change.
Thank you, Matthew. I'll invite Layla if you have anything you'd like to share.
Yes, thank you, Opal, and thank you everyone for having me. It's so wonderful to be here with you all. So, I think individual stories are often where people first encounter an issue, but those stories rarely exist in isolation. So, what can feel like a personal experience is often connected to a larger pattern, policies, histories, and systems. For example, when a Black patient shared that they felt dismissed during a medical appointment, it's easy to view that as a single interaction between two people. But when we hear similar experiences across communities or geographies and generations, we begin to see that it's not just an individual story, it's part of a broader narrative about trust, representation, access, and how healthcare systems have historically engaged Black communities. That's why connecting individual stories to the macro narrative is so important. Stories help us humanize data, while data helps us kind of contextualize stories. So we need both, right? One tells us what is happening, the other helps us understand why it matters and how widespread it might be. As for who's responsible, I think it's shared. Researchers, journalists, public health professionals, advocates, policymakers, and of course, we, the storytellers, all have a role to play. But as a strategist, from my perspective, I believe we have a particular responsibility to help make those connections visible. We have to ask, what larger patterns does the story reveal? What assumptions does it challenge? What action does it call us toward? In our work, we try to honor individual experiences while also helping people see the bigger picture. Because when someone realizes that their experience isn't just their experience, that others have faced similar challenges, they often move from feeling isolated to feeling connected. And that's what our work with the Green Book is all about. It's about community. And that sense of connection is often where collective action begins.
Thank you so much. I'll invite Maya.
Thank you. This is one, I think, as a fundraiser, but also as a representative for Out of Hand, I get very protective because when people make their decisions, they can only make decisions for the circumstances that they have in front of them. And those circumstances are largely shaped by systems. So you can look at individual behavior, but those that behavior is limited to what the circumstances are in front of you. You can't choose an option that's not on the list of options. So we do have very much we have a responsibility to talk about those systems, to talk about those barriers when we're telling stories, and it's very much a shared responsibility. And this is why at Out of Hand we work so closely with partners, and we make sure that the dramaturgy around our stories, or basically our research, really reflective of those systems and of true barriers. We may be telling the story of one person, but we have to put that person within a larger structure. We did a series called Thriving Together Atlanta, and it was around public health. And we were exploring health equity through storytelling, but and also making sure that we brought in other factors that are beyond health. And this is something that we will know at Grady, that things like transportation, education, food access, employment, your neighborhood safety, all of that things, those things matter to health. So you can't just focus in on, well, why did you eat this instead of that? That's a much bigger conversation. And so when we're telling the story, when we're telling stories with Thriving Together, that piece brought up things like the bus ride to get to the closest store that sold fresh foods, as well as the environmental factors in their neighborhood, like the factory down the way that's producing that's producing things that are going into the water supply. All of those things matter to public health. Those are the circumstances with which you can make a personal decision. So I get very protective. Like, you cannot just go after people's personal just choices, because you can only make a choices on your list of choices to make. So our stories create that empathy, but the data and the dialogue have to provide context for the stories that we tell.
Thank you all so much. And for the sake of time, because we've been having such a great, fruitful conversation, I'm going to ask one more question instead of the two more that we have planned, and then open it up for audience questions. So this topic is one that is very hot right now, and has been at the sort of center of our Circle initiative, talking with racial equity researchers across the region. From the conversations we've been having, there's both optimism and caution about artificial intelligence. Can you share your thoughts on the potential impact of AI on storytelling and imagination? And we could begin with Layla.
Yeah, so personally, I appreciate AI despite like many other things its flaws, but I see it as being complementary and not, you know, being a supplement. You simply can't replace lived experience. I think we can all agree on that. There's nothing like it. AI can never replace human creativity and imagination. An example I can share, our co-founder Shani often uses AI to create the visuals to support the work that she does in reproductive justice, but all of that creativity is grounded in her and her team's ideation, right? So personally, you can't replace the things that we bring to the table with AI.
Thank you. I will invite Maya.
AI is here, and it's been here for over 70 years. So we have to know that we're not going to stop the train from arriving into the station because it's already here. I think that we have to use it in a way that allows AI to democratize storytelling and give people access to creative tools. We mentioned our devices. There are a lot of AI tools that help people tell their stories more efficiently, but we have to make sure that we continue to have the lived human experience as part of that storytelling. I think that we also have to continue to question AI, because it's learning from existing data, which means that it can learn from existing biases and dominant narratives that don't serve us. So continuing to ask the questions of where is this data coming from? Where are the assumptions coming from that AI is making? Who's controlling this technology, and what stories are being represented, and whose voices are being amplified? Um, so we have to center equity and human dignity around the way that we're using AI to help expand storytelling. It can be a tool to democratize, but you always have to ask the question, who's behind the curtain.
Thank you. And I'll invite Matthew to close this question out.
No, I think Layla and Maya gave really great responses. I actually don't have anything to add.
Okay, perfect. So with that, we have about 12 minutes left of the session, and so I want to use as much of that time as possible to gauge questions from the audience. So you can either place something in the chat, or if we can allow people to now come off of mute, you can come off of mute and engage directly. We do already have an existing question in the chat, so I will prompt that to you now. It's from MG. Um, they asked, how does the panel feel about pay what you can or tiered pricing for events for local grassroots folks who just want to pay rent while doing this community work? And MG, and I'm not sure if that is your preferred name. If you would like to come off and explain a little bit more about the question, you can. If not, then we can just go directly in.
I don't have any more explanation. If there are any follow-up questions, I would gladly answer them.
Sounds good.
Yeah, our events are free. So, and I think having a pay what you can or tiered approach makes a lot of sense as well.
Yeah, I would echo that. We don't want the cost of a ticket to be the barrier that stops the conversation from happening. And so, as I mentioned before, we build our budget on a way that doesn't depend on ticket sales for us to continue doing the work that we're doing.
Absolutely. I agree. I mean, in our case, our events are free as well. I mean, one of the barriers that we're trying to overcome is access. So we by no means want to limit folks' ability to join us and engage and, share their experiences. And so, yeah, as much as possible. And honestly, in every way, we've made our events free. We actually give an honorarium to our participants, our first time participants, to just let them know that we appreciate their time, and sharing their insights with us. So
And I have a follow-up question to that then. For folks who, because I work with local nonprofits who are trying to establish themselves in the community. How do you and as a person who is a grant writer, trying to get those like small 2, 3, $5,000 grants to get things up and rolling. For folks who like are having a difficult time affording me as a grant writer, what do I tell them, or how do I like that's why I'm offering them like, let's structure your events as pay what you can and tiered. And I have the system where $10 for folks who are having a hard time, $20 for standard, and then if anyone can pay it forward, that would be great. But like, I guess any tips and tricks on how to make something sustainable when you're scraping the bottom of the barrel and still trying to make a difference. I guess that's what I meant by how do you feel about those tiered stuff for folks who are just starting out in their communities?
Well, I'll say that one of the models that works really well at Out of Hand are we have people who will host a performance. So we'll have someone who will cover the cost of the performance for the actor, for the facilitators, and then we basically will give that performance away. So maybe it's finding people who can host a performance for another group of people. We also have a model where some of the storytelling that we do are for contract or for earn income, where we're going into like a corporate team and working with their HR on a facilitated story and discussion, and then we can use that income to go back into our stories that we're telling in the community that we are not charging for, and we're working with partners in that way. And so our board and a lot of individuals throughout the community will basically pay the fees for us to present that so that the audience isn't incurring that cost.
Thank you. That really helps. I appreciate it.
Excellent. If Layla or Matthew, if you don't have anything you'd like to share, I can move to the next question. All right. So Karen, I believe, or Karen asked, how do you avoid stories of marginalized people being used purely for consumption by people who don't experience marginalization?
Yeah, I think this goes back to the earlier framing of, the intent that you have with the stories and the narrative that you're using, right? Often if the goal of um, collecting stories is to build narrative evidence, shift narrative power, to correct a dominant narrative, that is going to involve um, people who don't experience marginalization. I would argue that it's very rare that a lot of people don't experience marginalization of some type. But I do think that um, you have to be super careful about how you leverage the stories and the narratives and where you place them and with what audiences. And that goes back to respect not only for the individuals who you're collecting stories from, but also to the intent of your organization or the campaign that you're running. I'd also argue that we're either agents of change or like objects of change, and often in order to be an agent, um, you have to put yourself out there. And so we're creating opportunities um, where we can place our stories in front of people who can move things.
Um, Agents or objects of change. You need to copyright that. I will be using that for sure. Um, do either of you have anything you'd like to add?
Yeah, I think what Maya shared earlier about being mindful about who's asking the questions and like who's behind the curtain. I think that was very important because um, lived experiences and the way that we're collecting this evidence, of course, is very powerful, but we need to be mindful of what is the intent. Um, and so when I think about narrative power as a tool for change, I mean, to change the narrative and public perception in itself is powerful. I think narrative change is one of the most powerful tools we have for advancing health equity because narratives shape what people believe is possible, whose experiences are considered credible, and ultimately where resources and attention are directed. When you think historically, many of the stories told about Black communities and healthcare have been kind of like deficit based. We've often been discussed through the lens of disparities. You think of poor outcomes and barriers. And while those realities are important to acknowledge, they're not the full picture. So, narrative change asks us to expand the conversation and center community wisdom. You think about resilience, expertise, and lived experience. So, in my perspective as a strategist and storyteller, I think a lot about whose stories are being told, who's telling them, like we've been talking about, and what action those stories inspire. A good story doesn't just raise awareness, it can build trust and create connection and move people from just awareness to actual participation.
Mhm. And if I could just quickly add, one of the great things that I love about Out of Hand are our a company of facilitators that will work with audiences after with our when we have equitable dinners. We continuously train those facilitators to have guided conversations so that we let people talk and everyone can be heard, but also making sure that we keep the conversation a little bit on the rails after the performances, and we continue to make sure that we pour into those facilitators what they need to have those facilitated conversations.
Thank you all. So there's two last questions, and I'll just ask if you have something to say on either of them, just engage those quickly, and then we'll close the session out. The first question is just a general question if folks have used photo voice and how that shows up in their narrative work. Photo voice as the methodology. And then the second question is any general tips on training college students for participating in this space narrative storytelling for change or action?
I can take the question about training college students. So, as part of the Green Book for Health, we're working on an ambassador program. And of course, we're looking for ambassadors from all walks of life, all spaces within the healthcare field, outside of the healthcare space, college students, just everyone, quite frankly, because of the demographic our work touches. And so in terms of our ambassador program and the way we're building that, or we built that, we created an ambassador toolkit. And so that includes not just graphics and visuals that folks can share that come on board as ambassadors, but that also includes scripts and talking points. And so I think it's important to equip um, those you're looking to train with the tools that they need to be able to share the mission or share the work that you have at hand. So yeah, I would recommend creating kind of a toolkit that folks can access to be able to share your work in the way that you want it to be shared.
Thanks, and definitely, Matthew, I was going to invite you to talk about the CARES program.
Yeah, we're doing exactly that through CARES, working with college students to craft their narratives, using a number of different narrative frameworks, storytelling frameworks, and then building collective agendas and narrative power through that opportunity. So happy to connect with folks offline if you have questions about how we're doing that. Happy to share what we've learned and what we're continuing to do.
And I will just quickly add that at Out of Hand Theater, we have a community impact lab that college students as well as others can join. And we even have a version of this in one of our local high schools at Drew Charter High School, where we're training high school students, but we can also train college students and adults on how to become a facilitator, on how to do appreciative inquiry, and all of the different elements to do this work.
Thank
Thank you so much. I'm seeing a class being formed here, and or maybe an internship class or something like that. So this is great information. I appreciate you all.
Thank you. Thank you for engaging. And that's our final question. Thank you so much to our panelists and Dr. Sapo, who had to jump early. And we will turn it back over to the Partner for Advancing Health Equity team to close us out.
Thank you, Opal, and thank you to all of our guests today. It was a very engaging conversation and definitely a lot of things to learn from and follow up on. There's been a whole bunch of links and contacts being shared in the chat. Please feel free to reach to any of us with any questions or if you'd like to connect further on any of these topics. I also shared on the chat a link to our survey for this session. So please take a minute to fill that out and tell us how useful was this session to your work. And finally, I hope that you all can join us for our webinar on June 24th at 1 p.m. Central Time. It'll be another great and engaging conversation on this very same topic. So I hope all of you can join us. Thank you all again. Thank you all for coming into our session and lending us your time. And please stay tuned to the resources that are going to be coming from the whole series. Those are going to be published soon. So visit our website, join our newsletter, and become a member of Partners for Advancing Health Equity. Everything that we do in our membership is free and accessible. There's tons of resources on our website, so please do visit us. Thank you so much, and have a good rest of your week. Thank you all.